Hello, and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Ron.
I'm Jean Marie, and Lita will not be joining us today. She is indisposed. But collectively, we are the hosts of PodcastDX, and returning to our show once again is our guest, Sheila Ames. Hi, Sheila.
Hi, everyone. So glad to be back.
We're so happy to have you back.
Yeah, absolutely. So, again, thank you for taking the time to join us again this morning. Can you start out by first reminding our listeners what exactly is CVID, common variable immunodeficiency?
Would love to. So common variable immunodeficiency, I'll start calling it CVID through the rest of the podcast, is a type of a primary immune deficiency, not to be confused with autoimmune diseases. Mm-hmm. Autoimmune typically is an overproduction of the immune system, whereas many primary immune deficiencies are an underproduction of certain components of the immune system. With CVID, what is most common is low production of antibodies. In particular, there's a few types of antibodies that are one of the main ones responsible for most infections that we produce little to no of. And another common trait for CVID is also not reacting to many vaccines. So that's another thing. I have some vaccines I do have my own immunity to, but then others I do not. So that's another one of our risk factors with CVID. It is pretty rare. Oh, sorry.
No, go ahead, please.
I was just going to say that the reason why it's rare is because, on my last podcast, I think I said it's like 1 in 50 to 60,000 people that have it. It depends on what resource you're looking at, but I started looking into it a little bit more recently. And what I've noticed is that a lot of the newer resources are saying closer to 1 in 25,000 people, which is interesting because, I believe more people are getting diagnosed. Mm-hmm. And so that number is starting to decrease a little bit more and more, but that's a little bit about what CVID is.
Okay, I have two questions. Do you think it's often undiagnosed because it's just not something you would typically think of or even look for? And as a follow-up to that question, was it mainly because of your education and your training? Is that the reason why you were able to get a diagnosis, because they actually were checking your titers and everything? And then my other question is, I know I have so many questions. In terms of vaccinations, does it matter if it's like an attenuated vaccine versus, like a something that's been artificially produced? Does that affect your response to them?
Okay, I am going to try to remember those questions.
I just want so much info.
It's great. No, it's great. I totally enjoy talking about it because I think knowledge is power, and the more people that understand this, the more that it helps those with this to be able to, communicate and live with other people so they understand where they're coming from. I mean, the truth and understanding each other is how we're going to become a better race of, people on this planet, right? So, okay. Where do I start? Let's start with vaccines because that's what I remember at the moment. It doesn't matter if it's artificial versus not.
Okay.
We cannot receive live vaccines, however.
Okay.
So if it's a live virus, it can end up blowing us into that full infection of that. So that is something that is interesting to hear. And, with the COVID vaccine and whatnot, different people with CVID also, some are reacting somewhat to the vaccine, some not so. I do have antibody production from the COVID vaccine, but there's another component, and I had to drive 3.5 hours actually to get these lab tests because they're so not normal to get. Most common public, lab test is just to see if you have antibody production or not. Mm-hmm. There's another one, and I can't recall the name of it without looking it up, where basically what it means is that I cannot prevent COVID from infecting my host cells.
Okay.
Even after having received 3 full doses at this point. But I do have antibodies at least to help fight the production. So with that, at least I can get sick with COVID, but at least I do have some protection. So possibly, hopefully, I wouldn't end up hospitalized from it.
Okay.
So I do still shelter in place because it's still unknown. I mean, there's so many unknowns with this virus. It's so I do still, and I use the term shelter in place. I don't, whatever term is appropriate, but I hardly ever go out, basically, is the point.
Yeah. And thank goodness for, Zoom and all of those other technological advances that let us communicate and spend time with one another, despite everything that's going on.
Absolutely.
My other questions were regarding the ability to diagnose this condition.
Oh, right.
Because,
yeah, it definitely did not have to do with my medical training.
Okay.
In fact, most doctors do not know what CVID is. Most doctors that I've encountered do not know what CVID is. Even going into the ER, they don't know what CVID is. And, to doctors who are listening, I apologize if you are familiar. It's not anything personal, but the ones that I've encountered, most do not. So, it's not something that a doctor would say, oh, you probably have CVID. Let's send you on to the right direction. It took my persistence. It took it took me being sick straight for a year and a half and being upset about the whole situation. And, I'd had multiple infections prior to that year and a half that were kind of persistent, but I did eventually get over them. It wasn't until I had a bronchial infection for a straight year and a half. And I was in that doctor's office every 2 weeks saying, figure this out, run more tests, run more labs, run more whatever you can think on the top of your head. I went through 3 or 4 doctors during that time, 3 or 4 primary physicians during that time. And it wasn't until I finally found an internal medicine doctor that I had been working with him for a while. And he's like, you've had like every test I can think of done, and said, okay, we're going to send you to an immunologist. And I told him my whole story. And immediately he said, I think I know what you have. He ordered the appropriate testing that I had never had before. And basically we were looking at my my immunoglobulin levels. So immunoglobulin, also known as antibodies, and it's the specific type of antibodies. So immunoglobulin G, immunoglobulin A, and immunoglobulin M. You can see them as IgG, IgA, and IgM. Ran those. And then we also did vaccine trial as well, where I get titers done, meaning we see just how many antibodies I have, like say, for instance, pneumonia was one of them that we had done. And I was an ICU nurse at the time and exposed to a lot of pneumonia through my patients, a lot of ventilated patients on pneumonia and whatnot. And I had little to no antibodies for pneumonia, and then was given pneumonia shots and waited 6 weeks after that, and then redid titers after the pneumonia vaccines. And again, no reaction. So, and that's just one of them. We did a few others as well, but those are the common things. So it took persistence. Anybody who has ongoing anything, you have to be persistent for your own. You have to advocate for your own self to really get a true diagnosis, to really understand what's going on with you. So persistence is my key word.
Sure. And with all the complexity, or the human body, well, I guess all animal bodies are so extraordinarily complex that they can't get all those details in all of the possible conditions fully explained in a 4-year medical degree. So maybe it was a 5-minute mention or something. Yeah, it's a lot. So it's great you found a specialist.
And the percentage of what we know about our body, even with specialists and even with everything, is still so minute.
Oh, yeah.
I mean, how is it even possible to know how much there is to know about the human body? And things change too.
Yeah, we
evolve.
We were just talking about psoriasis and how little is actually known about it, or the causation and everything. And it's amazing that we think we know so much, and then you realize how much there is yet to learn.
We realize how much we don't know.
Well, I was going to say, I was trying to put a positive spin.
Well, I mean,
future generations there's still so much available for them to research and learn about.
But I mean, when we get to the point where we think we know everything, then we're dead in the water.
Right.
When you realize there's so much more out there to learn.
Yes.
Yeah.
Well, I think knowledge is infinite.
Yes, absolutely. And I think every day I'm learning I know nothing. And it's being reconfirmed.
I thought you said stay positive.
Oh, yes, I'm sorry. I have more to learn, and I can
There
get that
you go.
dopamine hit every time I learn something new, which right up there with sugar is what's running my body.
All right.
Yeah.
So, Sheila, I think you kind of touched on it a little bit earlier, but what do you think has been the most challenging part of living with a chronic disease, especially during the COVID pandemic?
Solitude.
Oh.
Yeah, I mean, I'm still at home. I do utilize Zoom. I didn't know what Zoom was before COVID. Social media, telephone calls, FaceTime, things like that. But there really, truly is no replacement for that human touch, that human personal interaction, and just getting out from your home and like seeing new trees and new sky and people doing different things throughout your day to day. When I do go out to the grocery store, like as rarely as I do, it's like this thrilling, exciting experience. And, it's like, oh, people buzzing and moving and doing this and that. And like, oh, there's a new product on the shelf. What is that? Like, you appreciate these things so much more. But I also appreciate things here at home. Like, I live in a forest basically. And, I live up in Northern California, and there's, my whole backyard is just trees. And so, you start noticing the little details that you don't ever notice before. But you were talking about challenges, and here I am going into the positive side.
That's okay.
Well, no, I mean, you have to,
Yes.
I was at home for a year, and we were doing Zoom with my students and all of that. And it was a little difficult going back. I mean, now we're back full time, and it's like nothing's changed. But at first it was kind of cool because you didn't have to get up and go into the office. But after a while, it was that isolation. You may have seen people on video and talked with them, but there is nothing like actually face to face.
Yeah, humans need that.
Right.
Yeah.
So, can I also ask then, how have you and your healthcare team, how have you decided to treat your
Or
condition?
manage, yeah.
Manage, probably a better word. Your condition in the last 2 years. What have you guys decided, or how are you doing with that?
Yeah, during the pandemic.
Well, since diagnosis, which was in 2015, I do receive antibody infusions every 4 weeks. And I just had mine last night, actually, my most recent one. And so that part hasn't changed. The only thing that is different is that if I do get exposed to COVID and, either just exposure to someone that's positive with COVID and or I become infected with COVID, I'm to go get monoclonal antibody infusion within 10 days of the exposure is my new plan that's added. It's a lab synthesized antibodies. They use mice a lot of times. Not all of them are produced from mice, but it seems like there's like 3 or 4 different kinds of types of monoclonal antibodies that are produced. And it looks like mice is kind of the more common one. So, and, if I were to decide to want to go back into my nursing position, I just learned actually just a few days ago from my immunologist that could be an option, that I could add that infusion every 4 weeks as a regular maintenance kind of thing. And so I've been kind of thinking about that and contemplating it. And I really don't think I want to go that direction, just because it's already enough getting one infusion every 4 weeks and the effects that it has on the body. And we put so much stuff in our bodies that, I'm always skeptical and cautious, but I also want to learn and understand the science as well. So that's just some things in my mind going on with that option right now. But anyhow, yeah, that's kind of how things have changed a little bit since COVID in the last couple of years with my
and since the last
diagnosis.
time we talked with you.
Yeah.
And Sheila, how have you been able to manage stress during the pandemic, and what's helped you the most dealing with stress on a day-to-day level?
Well, I was talking to a girlfriend last night, and actually, it was my nurse that infused me with my infusion last night, and she said, I've really noticed such a difference in you, and it's for the better, and your ability, with stress and how you manage your day to day, and how you're not as stressed out at all.
Mm-hmm.
And because I was full-time working as a nurse with a chronic illness, with exposures, with getting more common colds, which common cold brings me down more harder and longer than I'm still getting over a cold from 2 weeks ago, actually. um and I'm like, yeah, it's amazing. You don't really realize the stress that you're living in your life when you're in the middle of it
Mm-hmm.
Mm-hmm.
until
Right.
you're able to step back and feel what it's like to not have it. And then you look and you're like, oh, wow.
Right.
And so, I have developed my own business over the last couple
Mm-hmm.
of years, which comes with its own stressors, et cetera. But now that I can control my time and can control my life in many ways, I don't let myself get to that point, because stress is harmful and stress does cause disease. And who knows? They don't know what are all of the factors that can trigger the genetic mutation that causes CVID.
Mm-hmm.
And who knows, maybe stress is one of those contributing factors.
Mm-hmm.
Right.
We don't know. So I do try to manage and control that pretty well. I do meditate. I do spend time in my beautiful little forested backyard, and just talking to the trees. And yes, I'm a total tree hugger. So I have a better control over that. That's been one of the beautiful things of the pandemic, actually, for me.
Very nice. And
Mhm.
I will throw in there, because I know she would be saying this right now, but definitely Lita, my mother, would be mentioning that she loves Northern California, especially for the gold panning.
Oh, fun.
Yeah,
Okay.
so she spent many a day out in the wilderness gold panning up there.
Well,
Yeah.
maybe someday we'll have to gold pan together.
Absolutely. She loves it.
Well, getting back to CVID.
Oh, yeah. Sorry. Well, I was thinking about stress reduction.
Yeah.
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 Well, Sheila, how common is, bear with me, how common is common variable immunodeficiency? The fact that common is in the name should give it away, but I don't think that's the case, is it?
Well, yeah, I could totally see how that would be confusing because, all right, so I'll tell you the story. So as I mentioned at the beginning, CVID is, now they're looking at 1 in 25,000 people. So that's not very common. I don't know 25,000 people in my life. But where it comes from is common variable immunodeficiency is a type of primary immune deficiency. There's 3 categories of immune issues. There's the primary immune deficiency, like I have, there's autoimmune diseases, and then there's acquired diseases like HIV. So with primary immune deficiencies, common variable immunodeficiency is the most common type of a primary immune deficiency, if that makes sense.
Mm-hmm.
They call it variable because there are some main components that are required to have a CVID diagnosis. One of them is, your IgG, IgA, and IgM levels are on, between a much lower scale than the common public. As we mentioned, the other one is that, you may not react to, you have to show that you don't react to certain vaccines. And then, there's some other factors as well, like low T cell counts and some other things as well that can play into that factor. But some of those other things as part of the immune system can be variable from one person with CVID versus another.
Okay.
The other interesting thing, too, is that a lot of the diagnoses that have been discovered out of the primary immune deficiencies have come out of that pool of common variable immunodeficiencies. So, there's more severe types, like severe combined immune deficiency. I believe that's the bubble boy one.
Oh, yeah.
And so that's much more severe. Fortunately, I don't live in a legit bubble. I can kind of maybe feel like that sometimes because I've been isolating so much at home during the pandemic. But, that is actually tested for at birth. That's one of the common tests that they test for when babies are born in the hospital. But mine's not as severe as that, fortunately, but it's severe enough that, I'm of course still isolating.
Right.
Gosh, coming up in March, it'll be 2 years. 2 years. It's crazy to think. We had no idea that it would be like this.
Well, thankfully, you have trees in the backyard.
Yes.
I know. The trees are my friends, man. They're.
I was going to say, I'm trying to think of what forest bathing is. Shinro something. I can't think of what it is right now, but yeah, forest bathing is supposed to be beneficial.
Mm-hmm.
So
I actually have a couple lawn chairs in my backyard that's kind of deeper away from the main house, and that's what I do basically. I hang out there. Sometimes I get on the ground and I'll actually roll in the leaves, and yeah, I'm a total earth girl.
Well,
I'm thinking a hammock.
Okay.
Oh, that would be fun. Yeah, I would like a hammock.
Yeah. Okay. Throwing it out there for your son for gift ideas as well.
Oh, great. All right. Now that you know my gift idea for him.
Yes. I'm sorry. We were not going to tell anyone.
Good.
But yes. Okay. Are there any studies going on right now to try to find a cure or reverse CVID on a genetic level?
Yeah, there's no cure right now, but I don't know a whole lot about it. There is a little bit of, I don't know, a little bit, I don't know how much, but there is some studies going on about gene splicing, and they have identified specifically what genes are being mutated that create CVID. And so they're looking into doing gene splicing with that. So I don't know if that'll happen in my lifetime. I don't know. We'll see. I don't know a whole lot about it.
Okay.
Well, I think, again, earlier, I think you touched on it a little bit, but how does self-care play in your everyday life other than hugging trees and spending time in your backyard?
People will probably imagine me as this, Northern California, long dreadlocked, crazy.
No, but I mean,
There's
again,
nothing wrong with long dreadlocks.
There's nothing wrong with it. And I don't mean that it's crazy at all.
No, I
don't. I've got a lot of friends.
Right.
But anyway, I am definitely an earth lover, but self-care is absolutely essential, because without it, like I said, I do have a couple other chronic illnesses, fibromyalgia being another one. And without self-care, the fibromyalgia does pick up, and I notice some of the symptoms with that. So, a lot of people think of self-care as being, taking bubble baths and doing mud masks and, getting a mani-pedi and doing these certain things. I'm kind of simple in that way. I do like my baths. But there's other things to self-care, which is, listening to your body and listening to yourself and your needs and setting boundaries for yourself.
That's a great one.
That are really important. Yeah, absolutely. Boundaries for yourself with what you can and can't do in a day, boundaries for your communications with others, for what you allow others to say and do. And, there's so many things that are involved in self-care. It's not just all the cutesy little, bubbles and bath bombs and fun things like that, which are enjoyable and are necessary also for self-care. And that's part of listening to yourself and your needs. So, sometimes you do need that bubble bath.
Oh, sure. But I think setting boundaries is probably one of the most challenging things to do. But that can be extremely rather advantageous. So, that's a fantastic one. I don't think we often think about it.
It's true. Well, since the pandemic, I've, gone through and become a board certified nurse coach, which means I'm like a health and wellness coach as with an RN. And so we talk about a lot of that with my clients about, listening to yourself and your needs and, what does self-care really mean? The more in-depth, the more personal, the more, so that's it's pretty important. It's essential.
Thank you for mentioning that, because that's
Well, in addition to the self-care, what about your friends and your family? How have they impacted you, or what kind of role have they played in your journey?
Well, a lot of the times it's phone calls. I, have on a rare occasion, very rare, especially if it's right after an infusion. I know my antibody levels are higher. I will on occasion meet with somebody, socially distanced with a mask on, and hang out outdoors, typically, and hang out and talk and, do whatever, we may do, go on a hike, which I do live in a community where there's lots of beautiful trails. And so that helps. But just friends checking in on me has been really great. And I know it's hard, especially when I have to decline so many invitations. I do like to be included in the invitations, even though I'll probably have to decline.
Right.
It's nice to be included.
Mm-hmm.
And then, my son that lives with me, he'll be going on 18 next month, which is crazy. He's
Mine too.
my baby. And he has been so instrumental. Like when I've gotten sick a few times since COVID. I've fortunately not had COVID yet, but he's so caring and helpful and empathetic.
Good.
And this last week, just 2 weeks ago, when I was sick, he actually came in and he literally tucked me into bed, like pushed the covers up under me and like made me feel all sweet and special. And I was feeling all horrible. So, things like that, just, it's the little things that really, truly just mean so much.
Oh, that's so sweet.
Mm-hmm.
Oh. And Sheila, what is the best advice that you've received for coping with a rare condition? And also, what advice would you give to someone who's been recently diagnosed with the rare condition?
Well, I don't know that I actually received advice. I was thinking about this, and I don't know that I remember ever really receiving advice, except for maybe, come to think of it, my immunologist did say, live as normal of a life as possible. It's like, well, what the hell does that mean?
No kidding.
So my advice, a lot of people say get involved in support groups and this and that. And unfortunately, what I found with a lot of these groups is that people really like to focus on the negative and the poor me, and I have this symptom and that symptom and this symptom and that symptom. Although that can help to know that you're not alone, it being in that mindset all the time is not good for your overall, positive mindset. And so my advice would be to find your people who are able to face it positively, who are able to find, like the joy in it. And, would I choose to have CVID? No.
Right.
But what has CVID taught me? It's taught me some amazing, beautiful things in my life, how to do self-care, why it's so important. It's taught me to spend more time doing meditation, to listen to myself, to do certain things. Heck, I probably wouldn't have my business if I didn't have CVID. And I'm so grateful that I've gone down this route, because this is so much more me than I think any other job that I've ever done in my life. So, it has brought me blessings.
Well, as a recreation therapist, I talk to my students all the time. And also my mother just came to live with me because she's older and not doing very well. But it's accentuating the positive things that make you happy. If you're dwelling on the negatives, then, it's just a negative mindset. Whereas when you're accentuating the positive things in your life or things that make you happy, then, for what it's worth, it just makes you feel about as good as you can.
Yeah, and I guess if you're focusing on your signs and symptoms rather than on what you can do, it can bog you down.
Absolutely.
Well, we are not our signs and symptoms.
Right.
Our signs and symptoms don't define us.
Absolutely.
They're a thing that is occurring to be acknowledged, and beyond that, we are so much more.
They're a part of you, but they don't define you.
Right. They're just
So, Sheila, how can our listeners out there learn more about you and also about CVID?
And your wonderful business.
And your wonderful business.
Thank you. Definitely love being able to plug that in.
Oh, sure.
The main resources that I have used that have been extremely helpful is Immunodeficiency Foundation.
Okay.
They have a lot of amazing free resources for anybody with any type of a primary immune deficiency, whether it's CVID, selective IgA deficiency, SCID, like I mentioned earlier. And I think there's over 200 types. So whatever type you may have, they're an amazing resource. They send you free information. There's even a whole book that goes into describing all of these different types, that is with great diagrams and information of the immune system and how to break it down, what it all means, etc. They've got educational materials for children with like cute little dolls and what does it mean to have an infusion? And then they give you little play infusion type things to insert into the doll so that you can have a little doll that is hooked up to an IV and, things like that. But they're really great. And they also know other resources when you have a specific issue. They were really instrumental, especially with the pandemic. And they checked in on all of us, gave us all phone calls and, so register with them for sure. Okay. The other one is my IG source.
Okay.
And they're more around, like, if you do receive infusions, not everybody with a type of a primary immunodeficiency receives infusions. So if you do receive infusions, definitely connect to my IG source. I receive these infusion journals from them that I keep track of all of my stickers for my vials with my lot numbers and expirations. So when there are recalls, I can double check and whatnot to make sure that, and so far I've not received any that were recalled, fortunately. But they also have lots of other amazing sources. They can, one or the other, I don't recall, can even refer you to different legal help and legal resources if you're needing that sort of thing as well, which can happen because people don't understand primary immune deficiencies. Mm-hmm. Like, who has even heard of a primary, even though there's over 200 types and, of primary immune deficiencies? Most people aren't familiar. They just hear autoimmune, and that's what people think and know. Mm-hmm. So those are two great resources to head out to. I do coach a lot of people with primary immune deficiencies if you're interested. And I also do a lot of plant-based nutrition coaching. That's been my biggest thing. I've actually lost 8 diagnoses and 7 medications living plant-based lifestyle.
Wow.
And yeah, I used to have daily pain. I think the last time we spoke about this, I was still having some daily pain. It was within a few months or so that I started noticing, wow, I'm not inflamed. I don't ache. I don't have any pain, no joint issues, no this, that, and I was able to start kind of dropping medications and diagnoses, which has been amazing. So I can be found at amesalchemy.com. My last name is spelled A-M as in Mary, E-S, and then alchemy is A-L-C-H-E-M-Y.com. And then I also have a couple really cool events coming up. One is for free with Dr. Akil Taher. I'm not sure how to pronounce his last name.
Okay.
He is somebody who had cardiac bypass surgery at the age of 61, and he's now 73. And since then, he's ran several marathons, triathlons, and he's climbed like the highest mountain in Africa, the second highest in India, and a couple in the States. He is an amazing inspiration, and I'm excited. So some of my events and whatnot you can find at Linktree Ames Alchemy, and that's linktr.ee/Ames Alchemy. So AMESALCHEMY.
Okay.
And I'm excited. That's coming up, and the recording will be available if those aren't able to make it live. So that will be available in the future, and that's just donation based. So nobody, you can donate $1, you can donate $0. If you can't, it's fine. It's I want the information out there for people. It's great inspiration.
It sounds like it. And we'll make sure we include links on our page as well, because it sounds like a great way to motivate people by seeing what other people have done and can do. That's fantastic. Thank you for that. And we're struggling with diet here and understand how important that is. So we'll be contacting you as well on the side.
That would be wonderful. Yeah. Would love to help.
Oh, good. And thank you ever so much for joining us again today. You're one of our favorite people.
Yay.
3rd time's a charm. 4th time, we'll see how that goes. It'll be fantastic as well. Because you're always providing us such wonderful information. So thank you so much for taking the time today, Sheila.
Really. Thank you so much for having me. I love meeting with you guys. You guys are very positive and helpful, and love that you're getting all this information out there to the world.
Yeah, and it'll be on TikTok, which...
How do you spell that?
Right.
Yeah, I don't even know.
So once again...
I think it's an app. I'm not even sure. Okay. But
sorry, just teasing you.
But Dominic knows about it, so we're all good.
But again, Sheila, thanks for joining us. I'm sure everyone, all of our listeners, learned a lot about this episode. Thank you again.
Yeah, we really appreciate it. And next time, Lita will be back with us. So But I know she wants to say hello as well, and wishing you well for the rest of the year. But thank you so much.
Thank you.
If our listeners have any questions or comments related to today's show, they can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram, and now TikTok as well.
However you spell it, it's there. And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.